This is Mr. Justin. He is 42 years old and has been managing mild hypertension with amlodipine 2.5 mg once daily. He came to the emergency department with symptoms such as shortness of breath, palpitation, and restlessness. He also reported trouble sleeping due to work-related stress. After a thorough assessment, the emergency physician confirmed that he was experiencing an acute anxiety attack. Therefore, the doctor prescribed him Lorazepam 1 mg daily for 1 week to relieve his anxiety. And also sertraline 50 mg daily to treat his anxiety disorder.
Hello everyone. In this video, we will be presenting a case study involving a 42 years old male patient, Mr. Justin, who experienced a panic attack and was diagnosed with an acute anxiety disorder. Let's start with the patient background. Name Mr. Justin. Age 42 years old. Gender male. Occupation accountant. Non-medical condition is mild hypertension. Presenting symptoms. Mr. Justin came to emergency department with the following symptoms: panic attack, restlessness, inability to sleep for the past few days due to work-related stress, sudden shortness of breath, trembling, visibly distressed, palpitations, excessive worry, acute anxiety attack, profuse sweating. Medication history. He has taken amlodipine before with the dose of 2.5 mg and taken once daily. Current treatment plan. To manage his condition, the following medications were prescribed: Lorazepam and sertraline, where Lorazepam is 1 mg to be taken once daily. This is a short-term medication used to quickly reduce anxiety and panic symptoms. Next, sertraline 50 mg, also to be taken daily. Sertraline is a selective serotonin reuptake inhibitor used for long-term treatment of anxiety and depression.
So, which pharmacological class Lorazepam belongs to? Lorazepam belongs to a class called benzodiazepine. They are medication that makes your nervous system less active. They are also known as central nervous system (CNS) depressant. The decrease in nervous system activity make this medication helpful for a variety of symptoms and conditions. So some of its action or uses is to reduce anxiety, as a sedative or hypnotic, as an anterograde amnesia, as an anticonvulsant, and as a muscle relaxant. So, what are the mechanism of action of benzodiazepine? Benzodiazepine target GABA receptors. GABA is the major inhibitory neurotransmitter in the central nervous system (CNS). Binding of GABA to its receptor trigger an opening of the central ion channel, allowing chloride through the pore. The influx of chloride ion causes hyperpolarization of the neuron and decreased neurotransmission by inhibiting the formation of action potentials. Benzodiazepine modulate GABA effects by binding to a specific high-affinity site, also known as benzodiazepine receptors. Therefore, benzodiazepine increases the frequency of channel openings produced by GABA.
So now, I'll be explaining about why Lorazepam is used for Mr. Justin. As what has been presented before, Mr. Justin came to the emergency department with panic symptoms such as palpitations, short of breath, tremblings, and excessive worries. As a result, Mr. Justin has been diagnosed with an acute anxiety attack. These symptoms are very distressing and need a rapid relief. As a result, the doctor has been prescribed Lorazepam 1 mg as a medication treatment for Mr. Justin. It is because Lorazepam works very quickly to relieve symptoms like palpitations, restlessness, short of breath, and insomnia. In other words, Lorazepam helps reduce distress during high-stress periods, which can encourage sleep, reduce anxiety, and cause calmness and quietness in the patients. But do take note that Lorazepam is only used for short-term relief, while waiting for our long-term medications to take effect. Lorazepam is effective for fast relief, which is between 30 to 60 minutes to start working, and it's only prescribed for 1 week under a close monitoring. Why Lorazepam is only for a short terms? Let's discuss. If using Lorazepam for too long, it can cause dependency, tolerance, or addiction risk. Let me explain further about these 3 causes. Dependency. It is because physical and physiological dependence can develop even after a few weeks of use. For example, by suddenly stopping Lorazepam, it may cause withdrawal symptoms such as rebound anxiety, insomnia, irritability, or even seizures. Second, tolerance. It is because the body gets used to Lorazepams, so over time, the same dose becomes less effective. It may cause patients may need higher dose for a same effect, which increase the risk. And lastly, addiction's risk. It is because of the calming and relieving effect. There's a risk of misuse or addictions, especially in people with a history of substance use. Medications combinations with sertraline. Sertraline is an antidepressant SSRI, which is selective serotonin reuptake inhibitors that treats anxiety for a long-term treatment. Sertraline takes 2 to 4 weeks to work fully. So, you can summarize that Lorazepam is only bridge the gap until sertraline becomes fully effective.
The important counseling points for patients prescribed Lorazepam. Firstly, Mr. Justin should know that this medicine is meant for short-term use only, and he will be taking it for just 1 week. Taking Lorazepam for longer than is recommended may develop dependence or withdrawal symptoms like irritability or trouble sleeping. The other one is the adverse effects, where the bad effects that Mr. Justin will gain if not taking Lorazepam as directed. The most common adverse effects are drowsiness or feeling sleepy. So, it is important for Mr. Justin not to drive, operate machinery, or do anything that requires full alertness. Lastly, Mr. Justin should avoid alcoholic drinks because when Lorazepam combined with alcohol, it can slow down his brain activity and multiply their effects, which increase the risk of severe drowsiness, breathing problems, or even unconsciousness. That's all from us. We hope our video will be informative to all of you. And thank you for watching.